Well, we're very fortunate to hear from the senator, but we also are very fortunate to have a member of Congress with us, a member of the House, rather. Representative Phil Rowe represents the 1st Congressional District of Tennessee. He's now serving his 5th term in Congress, and he chairs the House Committee on Veterans Affairs. He also serves on the House Education and Workforce Committee. He's also the co-chair of the House GOP Doctors Caucus, an MD, and a member of the Health Caucus. He's a native of Tennessee. He earned his medical degree at the University of Tennessee. He then served 2 years in the United States Army Medical Corps. And prior to serving in Congress, Chairman Rowe was the mayor of Johnson City. And in Johnson City, I love this, he ran a successful medical practice for 31 years. We have someone who knows something about healthcare firsthand, delivering close to 5,000 children. Please join me in welcoming Chairman Rowe.
You're okay. Listen, thank you all very much for being here. And you did mention that I'm an OBGYN doctor and basically a country doctor. I practiced medicine in Northeast Tennessee for 31 years, and then went off my medication, and look what happened to me. I ended up in the U.S. Congress. So the thing I did do also, I say this as a joke, but it was there's a lot of truth in it. I delivered a lot of my own voters. It turns out they've gotten old enough that they're now. I had surgery about three and a half months ago, and the nurse that took care of me that night, she said, my mom said, you delivered me. And I said, well, did I take good care of your mother? She said, yeah. Well, I said, well, do the same good job with me then. I'm going to just talk a little bit about what you all are doing and trying to do from a physician's, not from a politician's standpoint, but, and I'll share this story. Some of you were at the palliative care meeting yesterday, but I'll share this where I'm able to do that now. In the last 3 years, I have lost my wife to stage 4 colon cancer. My mother died a year later. One of the best friends I'll ever have on this earth, if I hit a bad golf shot, he was there with me. His name is Phil Street. He died of cancer. So I've been through this personally with my own family and many, many decades as a physician. And it's one of the hardest conversations you will ever have in your life, is to sit down with somebody and tell them either there's your life now is in God's hands. There's nothing more that we can do but to extend your life somewhat maybe, or to make it as comfortable. And we want you to have those decisions. And I can tell you, some of you've done it, but to sit there at your wife's bedside and do that is very hard to do, I can tell you. It's the hardest thing I have ever done in my life. And to someone you care about and love deeply, that you do this with them. But it was the thing to do. She was a nurse, and we were able to have some great conversations together before she died about what we'd done in our lives. We left nothing unsaid, and we basically, she never left the hospital. I could never get her home, which is where I wanted her, but she never got well enough that I could do that. It's not about money and saving money and budgets and all that. It's about patients that we take care of. And it's very individual, and you all do that. And many of you are in the private sector, are out developing systems where with your private insurance plan, you can do that. And I understand you had a patient who experienced this themselves this morning. I wish I could have heard his talk, because it is unjointed. And how many physicians are out there? Okay, well, great. I don't know about you, but it was an electronic health record that made me a congressman. We put one in our office, and as my wife was in the hospital, I talked to medical students, and I would talk to the doctors and nurses. And it was unbelievable that they spent more time entering data than they did actually sitting by my wife's bedside. It was amazing to me. And they were good people. They were people I knew personally. I'd been there. They all knew me. But we've gotten into this, if we don't get all this data, you're a bad doctor. And I've seen this over and over again, and that time would have been much better spent at the bedside. And I can tell you, I'm writing right now. I haven't finished it, but many of you are old enough to know who he was. But I'm writing what's happened to Marcus Welby. You need, we've lost that person who is in charge, who will help you go through these terrible decisions that you have to make as a family. Someone that can walk you through that. And I've done that with far too many patients over the years. And when I got to Congress, I know Senator Wyden was, and by the way, if you go by Senator Wyden's office, be sure to encourage him to keep his enthusiasm for IPAB repeal. Some of y'all may know what that is, and we got 307 votes on the House side, so we'd like to go ahead and get that passed and signed into law. I think the thing that you all are doing on the private sector side, the beauty is it can move much quicker than we can here. And when I got to Congress, I've never understood, and to this day, after 9 years in this place, I have never understood why health care is political. It makes no sense to me. It should be about quality of care for patients, however that's done. And we can have a good debate about how that's done, but it should be about, that should be the central focus, is these policies that we make, whether they're in the private sector or the public sector, how does it positively affect patients and their families? Because ultimately that's what it should be all about. And I think Senator Wyden's right. There's enough money in the healthcare system to deliver healthcare to everybody in this country, I think, if we do it properly. I really honestly believe that. I mean, I see the waste. I saw it in my own family when they were in the hospital. After my wife died, I had the conversation, my mother and I talked. She was 93 when she died, and I was on an airplane heading out of the country when I was called. And we had sat down, my mother and I had sat down and had this conversation. And it's not comfortable to have that with your only child, with your mother. But she told me what she wanted to wear, whatever, everything that was done, what songs were sung, and I carried that out. I did exactly what she wanted. So, but we had that conversation. When that phone call came from the emergency room that your mother's had a cardiac arrest, what do we do? It was an easy decision. It was because we'd had the conversation. And it is a very hard conversation to have. Even as experienced as I am at it, at sitting down and doing it, I can look at these physicians out here. It's not one of those things you look up forward to thinking, oh, good, I'm going to get to do that today. It's very hard to do. It's a conversation we need to have with America. And we need to have everyone thinking about it. Nobody wants to think about dying or having a chronic illness that incapacitates them in some way. But it's a conversation that we as a country need to have. And I thought it was imperative that a conservative doctor, and look, with the congressional district I live in, Attila Hunn's a liberal there, I can tell you. And so, but I thought it was important that a physician like I am, to have this conversation to say, this is not about left or right, this is about people. This is about doing the right thing for patients. And so I want to thank you all that do this work. This is, it's much easier for me to deliver a baby and bring happiness into a family, which I just had my third grandchild. My daughter had my third grandchild. Men always have the babies, you know how that is. Our third grandchild, and that's a lot more fun to do than it is to sit down with a grandmother or a mother who has breast cancer or whatever it may be and have that conversation, I can assure you. So I want to personally, as a fellow, as a colleague, thank you for the hard work you do. It's draining, debilitating work, but rewarding work. It can be very rewarding work. And thank goodness there are people like yourself that do that. I have just going to mention this, and then I'll take some questions. I have a few minutes. We have votes at 1 o'clock, but I've got a few minutes. We have a bill called the Patient Choice and Quality Care Act, a palliative care bill, and a Senate companion bill. And it's Senator Warner and from Virginia, and Isaacson from Georgia, and Representative Blumenauer from Oregon, and myself. So when they see Earl Blumenauer and I come into a room, people start scratching their heads. What in the world could these two guys be agreeing on? But we totally do agree on this. And it basically puts patients and their families, as we heard the senator say, in charge of those decisions, not a system in charge of the decision. And it allows us these decisions to be transmissible across the state line. Very important if you travel. If you're retired and you happen to be in Tennessee and you go to Florida, you want those wishes, or vice versa. In the wintertime, in the summertime, you may come up to the mountains in Tennessee to spend your summer. And we want those things acknowledged there also. And then along some other things that I'm not going to get into with the bill, but it's a great start. It's not a finish line, but it's a great start in having this conversation with people. And we expect experts like yourself to be able to help us make better decisions and policies. Medicare will always be behind the private sector. It's just a huge organization. And I say this in all humility, one of probably the major problems with, as a physician saying this, with HHS is that there are 800 lawyers there. I thought, my Lord, are there any doctors that work at the place? But 800 lawyers at HHS, which seemed to be an oxymoron to me, but nevertheless, that's how many work there. I will finish by just once again thanking you for bringing this very needed thing. We have 10 to 11,000 people today will turn 65 years of age in the United States. And that baby boom bubble is going to continue for 20 years. All of us, that would be me included, are in that bubble. And we're going to need a way to go out. And I can tell you, I looked at someone asked me how much money did it require the other day. I'm on the Education and Workforce Committee. How much does it take to retire comfortably? And all the policy experts didn't know. And I said, well, I can tell you exactly how much. It takes, in Tennessee, where I live, it takes at least $60,000 a year, because that's how much it is to live in an assisted care living where we are and have a little money left over to pay your Medicare premiums and a few other things. Now, if you that's an assisted living, you take care of yourself. If you go into another, which my mother was in, it was more like $6,000 to $7,000 a month where I live, and we're less than many people are. So you're looking at $100,000 after tax money to be able to do that. And we have literally millions of people. And I will also pass along to you that after the age of 55 in this country, to show what a massive problem we have, 30-something% of people in this country have no retirement savings at all, zero, and no pension plan. They have a Social Security and a Medicare. That's it. So it's one of the reasons I've been so passionate about retirement reform in this country, because I can see that. I saw my mother, as frugal as she was, and I told her she always worried about retirement. And I said, Mother, you don't have to worry about that. You got a great backup plan. She said, what's that? And I said, me. I'm your backup plan. She might not have thought it was pretty good. I thought it was. I was going to take care of my mother, and I had the resources to do it. But many people do not. And I watched her. We sold a little house I grew up in. It was $96,000. That's what the house sold for. And it doesn't take you but a year, if you're in an assist, to go through your entire equity in your home. 1 year, it's gone. So it's a massive problem that we're facing in the country financially, how you care for people. And I think getting them out of these big concrete silos called hospitals and getting people into their homes where you can provide the care there is far superior. Whether it's less money or not, I don't know that. I'm not a policy expert in that. It's just better, I can tell you that, having experienced both. So I'll conclude by, again, thanking you all, and I'll take a couple of questions if you have any. Thank you. But I'm not going to get between you and lunch, so you don't have any, that's fine too.
So, Congressman, I will ask a question. With regard to the bill that you just talked about, can you talk a little bit about the politics of it in terms of getting it from where you have it now to actual passage, and also what can people in this room do to support you?
Well, I can tell you it's not going to happen in the next 3 weeks. I can tell you that with all that's going on up here. But the way it was interesting to me, I was a doctor. I practiced medicine full time when I was mayor of Johnson City, and most people thought I was overpaid. I got paid $150 a month to do that job, so it wasn't a very high paying job. So I'd never really gotten any legislation done at all. I mean, we had a bill we took, if I could convince 2 other people to vote with me, we passed it and went on. Here you got to get 218, and that's a little harder. You talk about herding cats. This is a herding cat capital of the world. And the way you do this, the way I do this with a bill like this, is that Aaron Bill, my legislative director, will hand me a stack of cards. Once we've gotten the concept done, and we get it to committee and subcommittee, we have to do that with a bill and get it voted out. I'll go to the House floor and sit down individually with members, both on both sides of the aisle, and talk to them and explain. It takes a while to do it, but that's how you build it. It takes sometimes 2 or 3 or 4 Congresses to get these things done. And then you find a Senate companion on the other side. You begin to meet with them, and they have different rules in the Senate, of course. And what they told me when I got here to the Congress was that I'm a Republican. They said, well, the Democrats are your opponent. The Senate is the enemy. I actually now believe that. But that's how you work these things out. And what you can do, I tell you how, you're the people that work every day in the real world seeing patients are the most effective lobbyists in the world. You bring real world experience. So when you go in and talk to a member, you explain to them what you do every day. And that's absolutely the most effective. When I have people come in who are paid lobbyists, that's one thing, that's fine, I listen to them too. But when I see somebody out every day doing what I did, and I know what they're doing, I know I know their job, that is the most effective thing you can do. Down and say, this is what I do. These are the problems I'm running into in taking care of my patients. People get that. And the reason they get that, because there is not a single member up here that doesn't have a similar story to mine, or will have, one or the other. So that's why it's personal. That's what you can do to help. Well, thank you all very much. Have a great rest of your day.